Good morning, everyone, and welcome to yet another live video edition of your award-winning Let's Talk America with host Shayna Thornton. Of course, I'm Shayna, and I'm so excited to be with you on this weekend talking about important topics and fascinating people. And right now, this segment is no exception to that. Many of us go to the physician, and many of us go see our primary care physician. And right now, we have someone on with us, and there was a lot about that, and she's got an important message also to share for us. I'm talking about the one and only Dr. Tara Chadwick is with us right now out of Washington State. So excited to have you on, Doctor. Welcome.
Thank you. I'm excited to be here.
Ah, and one of our favorite topics, Doc, is health, of course. So this is right up the alley of Let's Talk America radio podcast. Before we get started, we have a tradition here on the show where we ask our exclusive guests, and this is your first time debut with us, to really talk about 2 minutes or less about yourself. Okay, I've seen the CV, the resume, you're impressive, we get it. But what motivated and pushed you on a personal level to really go into this field, and why was it critical for you to be an advocate?
Yeah. I am currently a second year family medicine resident, just like was mentioned before, up in Seattle, Washington at Swedish First Hill Family Medicine Residency. And before getting to this job, I actually had a different career in the theater industry where I worked behind the scenes out in Chicago for quite some time. And during that period where I was working, I sort of realized that I was missing this one-on-one human connection where I could really make impacts in the community and really be there for people in the hardest times of their life and then also like the most joyous times of their life. And it took me a while to figure out that like that meant family medicine, but I got there. And it was initially after seeing a family physician out in rural West Virginia and seeing how they, as one person in the community that needed so much, could make such a big impact and really see families from the day they were born to the day they die and everything in between, and how much that meant to this community. And I think that connection just really stuck with me and sort of like propelled me forward on this path. And so I went back to school after having been out of school for like 5 or 6 years. I went back to medical school and then ended up here in Washington for residency. And during the medical school process and even now, I sort of found my voice in the advocacy scene, because as family physicians, I found out that we are perfectly situated in the community because we know everybody in the community to use our voice to really make an impact towards driving changes and social changes and system-wide changes in health. And in finding my voice, I've kind of found my voice within the American Academy of Family Physicians. And through them, I was able to sit on commissions. I was able to sit on their board of directors, go and talk to representatives and senators in DC and in my own states, and just really hear from my community and then use my voice to impact change. And I think that, as well as the direct one-on-one relationship I get with my patients, is really what keeps me going and what drives me and makes me love this career.
I love it. We love to see individuals in every professional, Dr. Chadwick, really have the passion you've demonstrated just now in the last few minutes. So thank you for being with us. As many of you can see, she's passionate, so we have the right person to really advocate a very important topic. If you just joined us, you are watching the award-winning Let's Talk America with host Shayna Thornton Podcast Radio. And we are interviewing on this weekend morning a physician that knows a lot about the medical world, as you just saw Dr. Chadwick explain her background story. But we're here today to talk about something very alarming, doctor, and that's that there is signals, flags that are going off right now that in a matter of a few years, we may have a national shortage of family care physicians. Help us out. That's scary for me to hear as someone who would want to assume that people would want to go in medicine, in particular family practitioners, because all that they do, like you demonstrated for the community. Why is this taking place now?
Yeah, and I actually would argue that this shortage is here. It's not future, it's here.
Oh,
If
wow.
you are anyone in any community out there, like how long does it take you to get an appointment at your doctor's office, your
Yes.
primary care doctor's office? And that's really because there is this shortage. I think there's been like a few projections out there, and the latest projection is that in about 10 years, there's going to be 40,000 family medicine physician, primary care physician shortage, and that was put out by the AFP.
Okay.
There's a few other ones too, but it is a real crisis, and a lot of us are trying to do things we can to help combat that crisis. But I think where it stems from is quite complex and quite complicated, and but the major factors sort of driving that, at least from the practicing standpoint, are burnout, administrative burden, the like fact of having to see having to see like 20 to 40
Yes.
patients in a day, and then you only get 15 minutes with them instead of spending the time you actually need with them, and you're sort of forced down that road by higher ups and insurance companies and larger conglomerations of reasons.
Yeah.
But there's that factor. There's also the factor of there's a lot of us questioning out there, like us being people who choose going into medicine, like whether or not it's the right choice, because we don't get paid enough. And you can go join a tech company and make 3, 4, 5 times the amount of money as you do as a family medicine physician. So the fact of reimbursement is a large issue, and AFP is definitely trying to combat that burden too, and taking steps towards making our value as family physicians known, and getting paid adequately for that value.
Okay.
I also think that as somebody who just graduated from medical school not too long ago, there is sort of a narrative that's been longstanding around family medicine physicians that needs to change, and that's going to take a large just culture shift. When I was going through medical school, and I hear this a lot from medical students right now who are choosing to go into family medicine, is that it's a lot of like, why would you do that? You're going to get so burned out. You're never going to actually be able to make change. It's the same thing over and over again. And this just this very harsh and, in all honesty, not true narrative that a lot of people try to sway students to not choose family medicine. And then by doing that, they don't choose family medicine, they don't go into primary care, and then we have this shortage, and we have this continued shortage for years and years to come. Yeah. I think in my medical school, it was a class of 80, and only 3 or 4 of us went into family medicine.
Wow.
I have a colleague who's going to match this year, and that's our process of matching residency. But she's matching this year, and same situation. I think she said she has a class of like 70 or 80, and only 2 people are choosing to match into family medicine. And I think it stems from everything I just said, the narrative that surrounds it, and how we need to change that. And all of that is inaccurate and not true. The price it takes to be a family medicine doctor, just through the work and the time and the money, the reimbursement, and getting paid adequately for what we do for our patients in our community. And then all of the administrative burdens that we have been working so very hard to try to change. Those, that's just 4 of the reasons. There's a lot of like underlying issues out there, but you're right. There is a very severe threat to family medicine and primary care physician shortage.
Chad, I have a question for you. As we think of the world population right now, I guess worldwide, it's about 8 billion people, right? Give or take a few billions. But is it also a possibility, and I'm just asking this, because the population is booming, because our baby boomers here in the U.S. are aging, right? And is that possibly a reason? Because I would think that those powers that be, whoever that may be, would plan long-term, knowing now we have baby boomers that were so essential to our workforce and contributing to society as physicians, right? They're retiring as well. And then comes the physical ailments that come with the aging process. In all fairness, is that an option or a possibility?
A possibility that is the reason why there's this.
One of the reasons, yeah.
Yeah, definitely. I mean, the aging population, there's a lot of people out there who are retiring now, and sort of just like how our population is growing, there's more people who are passing away and dying than there are people being born right now. But I think it's sort of the same. There was a large group of older docs who are deciding to retire and get out of the field and live the rest of their life happy and not working and doing whatever they want to do, which we all dream for one day.
Yes.
And because there's this large portion of people retiring and there's a smaller portion of people going into family medicine, obviously there's a clear
Yeah.
clear
There's a shortage.
yeah.
I don't want us to be remiss and miss the obvious because we have viewers that are watching live now. Thank you for everyone watching us here right now on YouTube and those who will watch it again, right? We're on demand. My question that begs a very important one is how do we fix it? How do we fix it? Because that's a fair one. I don't want to be remiss with that one. I also want to ask you, share with us and advocate what exactly does a family physician do? Because I think in the world where you hear people say they go to an endocrinologist, they go through a gastro, they're all over with specialty. Maybe their only memory of family practitioner very well could be when they were a little kid. So help us out because obviously when you're a child, most children go to pediatricians. Those are designated for pediatricians. So explain what a family practitioner does, and then tell us how we possibly could help you all fix the problem.
Yeah, I'll start with that second question first. So, family medicine is a sort of our quote is womb to tomb. So everything from the birth of a baby, which we can actually do,
Okay.
Deliver babies, to their last conversations and the day they die. And we do everything in between. And then, so in our work, we have the ability to be able to change our career paths up at any point, knowing that we have this very broad spectrum of training. And in residency, we learn how to care for babies, for kids and adolescents and teens, and then young adults all the way into geriatrics and people over the age of 65.
Yes.
And then with that training, we also get trained how to deliver babies. Like I said, we get trained how to work in the hospital and in the clinic. So we can choose either one of those locations. Okay. People sometimes work in the ER as well because we get training in there. Sometimes people who end up going rural will get specialized training in doing some smaller procedures like colonoscopies or appendectomies. I know there's doctors up in Alaska, family medicine doctors up in Alaska doing those things that surgeons do. And then in our offices, in our clinics, what's really unique is that because we care for the whole broad spectrum of ages, we're able to talk about things like family planning. We're able to remove toenails and remove cysts and bumps and look at rashes and kind of be that dermatologist. We can also talk about your heart and manage your heart problems without sending you to a cardiologist until you absolutely need to. We can do procedures in the office. We can care for our transgender population. We can do HIV medicine, hepatitis medicine, really anything you want to be specialized in as a family medicine doctor, you can do that. And you can learn how to do it, get the training, and really sort of tailor your practice towards what you want and what you like best. Or you can do the whole broad spectrum and do it all.
Nice.
Yeah. So family medicine really is such a malleable specialty. And because we're in the community so much and we see everyone in our community.
Yes.
We really are such unique in that way. There's not really any other specialty out there that's like that.
Yeah, so true. So true.
And I think that definition of family medicine gets lost, and a lot of people kind of think of family medicine as the doctor who's short on time, doesn't get paid enough, kind of has this overriding administrative burden, and then they just get burnt out. But what you will find when you talk to family medicine doctors is that we're some of the happiest doctors out there because we can change our careers up at any point and choose to do whatever we want. And it is not the same thing over and over again. I don't see diabetes twice in one day. And you'd think as a primary care doctor, that's all you see is high blood pressure, diabetes, and it's not true. And I think sort of this narrative that I mentioned is the thing that needs to change at the first medical school and pre-med student level. And when people are deciding which specialty they want to choose,
Yes.
we need to pull them in and show them how amazing family medicine is and how many different options there are within it.
Yeah.
And really, like, as a specialty, grow our mentorship, grabbing those pre-med students and those medical students early on so that they know this option is the best option. And then from there, no matter what they're told, how much burnout they might experience, or what that bad vibe is that they're getting from another specialty, that they've already seen it and they know, and they have a solid mentor in family medicine, and they're not going to change their minds. And then I think from like an early on standpoint, that's sort of like the thing we need to tackle the most is getting pre-med students and getting medical students early on, showing them how amazing it is, and changing the narrative and giving them good mentorship.
Yeah. Powerful.
And then I think from there, on a larger standpoint, there's all those things I kind of already talked about. Getting more financial relief and getting paid what we're actually worth. And we know that as primary care physicians, the more people come into our office and the more people come to see me as their family medicine doctor,
Yes.
I prevent that, and I prevent them from getting sicker and going into the hospital and
Yes.
causing more financial burden
Beautiful.
to the healthcare system.
Beautiful.
So the more they can come into my office and see me, the more I save the healthcare system money.
Nice.
And the more I prevent diseases, the more I prevent public health crises, the more I can connect a community, the more I can just make an impact. And I think that all of this combined deserves to get paid more. We as family physicians don't get paid enough. If we got paid the same as our plastic surgeons as colleagues, or the same as our orthopedic colleagues, I think there'd be a much larger portion of medical students choosing family medicine. It really is just such a sad state that family medicines are getting paid. Now, when I say they're not getting paid enough, we have to take into context that, like, most of the American household median income is far less than what family medicine physicians are making.
Correct.
But when you look at the span of doctors and specialties and what they are making, family medicine falls at the end, along with pediatrics and some other like general care specialties. So when I say they need to be making more, it's just in this spectrum of doctors and specialty spectrum salaries. Now, we are obviously very grateful for having a larger income than most of the American population, but we do spend a lot of years in schooling. We spend a good majority of our early 20s and sometimes 30s in training, getting paid less than minimum wage as a resident, and do make such a large impact on just the finances of the healthcare system in general, that we should get paid for that appropriately. I also think that the whole other piece of administrative burden is something that we're actively working on as well. It's quite hard. I mean, if I'm providing patient care for 15 to 30 minutes in the visit one-on-one, I spend just as much time as that outside of the patient room, documenting, charting, fighting back on insurance, prior authorization appeals, trying to get them over to a specialist when there's not enough specialists, like cardiologists or surgeons in the state. And I think that all of that also makes it hard to be a primary care physician, because we call it pajama time. And that just means that when you're working, you're in the office one-on-one in your work clothes.
Yes.
But then how much time are you spending at home in your pajamas, charting and documenting? And it's a lot. It's a lot. And that also needs to change. That needs to change as well. So I think there's a lot of things that we can do as in America, as people and citizens who get primary care and deserve healthcare and deserve a primary care physician and deserve not only a primary care physician, but a family medicine physician. There's a lot of things we can do individually to help out and advocate for our family medicine physicians.
I love it.
And that is anytime you hear about a healthcare policy you don't agree with, reaching out to your local representatives and telling them that, this is putting a burden on the healthcare system. This needs to change. It doesn't necessarily need to be exactly about family physicians, but just knowing that with every healthcare policy that comes out, it is likely putting a burden on our administrative duties. And
Yeah.
I think by using your voice, like individually, even if you're not in healthcare, it's still very, very
Yeah.
important.
Yeah. And when you say use your voice, I would imagine reaching out to legislative members.
Yeah, yeah.
Okay.
Go in the community too. If you go to town halls,
Yes.
you talk at town halls, go to your, if you're involved in PTAs or like your local school systems, you can make an impact there. Even in the healthcare, we have a lot of AAFP colleagues who are involved in their
Okay.
PTAs and their school boards. And I think just like I said, sort of the theme of this, like we're very involved in the community, and our voice as leaders in the community is very widespread. And I think that family physicians are have a big voice in local community, in state community, in nationwide community. And by just continuing to speak that voice out loud, whether it's from us as a physician or from our patients, I think the more we speak, the more we can make change.
I love that. It's about advocacy, and ultimately, obviously, it's about your profession, but also it's what patients need, right? I don't want to call them consumers in a sense, but patients, which we all should be a patient somewhere if it's getting the screenings. Thank you for sharing, Dr. Chadwick. I've got a question before you head out, and it's about what I just mentioned briefly. I've always seen family physicians as our important, critical gatekeepers,
Mhm.
right? Because I'm coming to you for the annual exam. You're checking a lipid panel. You're checking if someone's anemic. You're all over the place making sure that the patient's being taken care of, right? And from my understanding, and I've worked with family physicians in the past, once something is identified, and if it's something they don't necessarily have the expertise in, because that's what I love about family practitioners, there's so much they get to do, but also you could send them on to oncology. You
Mhm.
can send them on to endocrinologists. You can send them on to a nutritionist or a cardiologist. And you really are critical gatekeepers, because no one's going to wake up a gentleman that's living in San Diego and say, I think I'm having heart palpitations, so I need to go to the cardiologist, right? That's usually identified by the family
Yeah,
physician.
yeah.
So I say this as a patient somewhere, and hopefully all of our listeners, if you're live or you're listening to us on replay, you are a patient somewhere, because everyone needs screenings. Is that correct, Doc?
Yeah, 100% correct. Everyone deserves a family medicine physician, and that's who should be your sort of one-stop shop. And then they can take it from there. If they need to call in their colleagues for extra help and send you to the cardiologist, they can. But for the most part, you can go to your family physician with any question about your health. Or about the health of the community. And they
Yes.
likely will, if they don't have an answer, they can send you to somebody who
Right.
does. And more often than not, they're going to have the answer just because of our like wide breadth of knowledge.
Yeah.
But yes, everyone deserves to have their family physician. And if you're listening and you don't have one, I really encourage you to do a Google search or find your doc search and look up where your closest family medicine physician is, because the way we treat is very different. We focus on
Yes.
preventative care, just like you said, with screenings. We focus on whole person care. We focus on the care of the community. And I think that our one-on-one connection and our capacity to just listen and empathize is in our bedside manner, as some people might think of it, is we are trained in those things, and that's very different than other specialists out there. So you're going to get a really warm welcome and a wonderful care if you go see a family medicine
Yeah.
physician.
Talk right now before you head out about the stigma of perhaps for some individuals in certain communities going to the physician. As you know, for certain groups have been a mistrust in the
Mhm.
medical world. And unfortunately, COVID, when the world shut down, a lot of things went viral. on our very own YouTube, which we're streaming on right now, but other outlets as well, where things were not always legitimate or valid when they were speaking of medicine. You know that. You've even said yourself there are things they even share with the residents or students that aren't true, and it's unfair. But talk about the stigma of individuals that, good individuals, intelligent individuals. I happen to know, and I'm sure you know, they say, well, I'm fine. It'll get better on its own. And they're pushing off going to a physician, a family physician, because they're like, well, 9 out of 10, it's nothing. And it very well may not be.
Mhm.
But talk about the stigma of people wanting to go online, if you will. No touche towards us being online right now, but researching and Googling their symptoms and thinking they're doctoring themselves where they truly don't have the knowledge or expertise or training of a Dr. Chadwick. Help us out.
Yeah. I think the internet is a wild, wild place, and we go through years and years of training that gives us the ability to be able to properly diagnose someone and treat them according to science-based and science-backed medicine. You will not get that from an internet search. You will not get you might get somewhat of a similar answer to what we would give you, but oftentimes it is the nuances of it are incorrect. And I would say that to the people who are hesitant to go see their family medicine physician, I think there are a lot of ways in which we're still working to try to improve that and improve that trust in the healthcare system. And I think you're right, like with COVID, things sort of faltered and there's lots of fault lines in that foundation. We do know that when people talk about the voice that they trust the most in public health,
Yes.
it's family medicine physicians. And we as a specialty practice with science-backed evidence and science-based evidence, and we have to trust in the science moving forward. The other aspect to this, I would say, is that we also know from a public health standpoint that when you get physicians in your community who look like the community, who speak the same language as the community, who have maybe lived in that community in their past, the public health outcomes are far, far greater than people who do not look like that community, speak the language of that community, or come from that community. And I think that as family medicine physicians and the AFP, we know this, and we are working very, very hard to sort of fill those gaps and put people and bring people into the specialty who come from diverse, like we are a diverse specialty that treats a diverse population.
Yes.
And if we can get people in our communities who treating people in the community who look like the people or speak a language or come from there, there's just an inherent trust.
Absolutely.
And
Absolutely.
and that community might, change their mind and come in because they see a doctor who looks just like them.
Correct. Who perhaps can understand also the culture and the background, right? But we know, obviously, I think it's powerful for people to see all types, right? But I think how special it would be for perhaps a young lady who's never seen a female physician meeting a Dr. Chadwick and being inspired by that, and seeing others, because the world is global and it's seeing different faces and knowing that they can do it. They can do it.
Yeah.
Such an important conversation, Dr. Chadwick. Ladies and gentlemen, you're watching the award-winning Let's Talk America with host Shana Thornton Radio podcast. We had an opportunity this morning on this beautiful weekend to speak with Dr. Chadwick. She laid out a strong argument. If you have children, I'm going to say this, Dr. Chadwick, not you, but if you have children, grandchildren, godkids, please encourage them to look into a field of medicine and making sure they're looking at the full gamut. Because what I would hate to happen, Dr. Chadwick, is a kid saying they want to be a certain specialty and then they lose interest and think that's it for the medical world. There's so many different professionals in the medical world. If it's not family practitioner, it could be a nutritionist, it could be occupational therapist, so many things. Just to expose them is key. Do you agree?
I agree. We need you. And we need your voice in the healthcare professions.
Yeah, such a powerful conversation. Thanks everyone for watching. Before we head out, Dr. Chadwick, where could our listeners, international listeners, go for more information about everything you talked about this morning?
Yeah. You can check out the aafp.org website. That will give you kind of an idea about our organization and family medicine physicians in general. If you're on social media, you can check out the underscore AAFP. There's also Future Fam Med that you can check out.
Nice.
And we also have a podcast as well.
Oh, wow. Nice. Great. There's your information, ladies and gentlemen. Stay tuned in, stay educated, motivated, and be inspired. And guests like Dr. Chadwick will allow that to happen. This program will continue to highlight the best and the brightest guests as we had our world debut with Dr. Chadwick, and also with the topics and subjects you want to know more about. So many of you, if you say, well, nobody in my family is going into medicine, well, you are a patient somewhere. You should be. So you should know what's being advocated by these group of professionals. And also, never say never. You could have a niece or a daughter or a son who may go on that path, which again, as many of the, if you've ever been a mom or a kindergartner, we call them the community helpers. There are community helpers, which are so, so key. We have one quick question before we get out of here from Vicky and Robert out of Atlanta Metro. They said, I'm sorry, but I go to my primary to get the directions of what is going on with me, but I see for herbs that they may help me. Talk about that, some herbal treatment, they're referencing that. Help us.
Yeah, I think, it kind of depends on which doctor you go to. And I guess it also depends on like what herbs you're taking. And I think any sort of supplement or additional medication that the doctor didn't prescribe that you're taking, you should always bring into your primary care doctor's office and let them know. There are some interactions that happen with certain medications that we prescribe and herbal supplements.
Okay.
And so we like to just be aware of everything you're putting in your body. And as somebody who practices whole body health, I know that there are people out there who use herbal supplements or use over-the-counter supplements to kind of help with joint pain or high blood pressure or whatever it is. And all I ask is that you tell me and you're open with me so that we can talk about the risks and benefits of that. And I am never. For most of us, we're never people who are going to tell you like wave the finger and say no. And I think if somebody does do that to you, you just open up the conversation about why and see where their reasoning is coming from.
Yeah, such a great answer. Thank you so much, Vicky and Robert, for that question. It's one I think many people have that looms in their head, but they don't get to ask it. So thank you, Doc, for taking care of that. Ladies and gentlemen, boys and girls, stay tuned to our award-winning Let's Talk America with host Shana Thornton Radio podcast. We have more topics coming your way. Have a beautiful week. Fall weather is knocking really loud. So let's enjoy it and be intentional about every moment. Thanks, Dr. Chadwick, and listeners, stay tuned. More content coming your way. Take care.